that the recent 2014 Ebola virus disease outbreak has already 5,408 death cases and still counting, with approximately 15,000 confirmed cases, this epidemic remains on high alert with travel warnings especially on severely affected countries in West Africa, such as Guinea, Sierra Leone, and Liberia. The virus disease, formerly known as Ebola hemorrhagic fever, is a severe and often fatal illness in humans. Ebola virus and Marburg virus are related viruses that cause hemorrhagic fevers, which are illnesses marked by severe bleeding, organ failure, and in many cases, death. Viruses live in animal hosts, and humans can contract the viruses from infected animals. Both viruses are native to Africa, where periodic outbreaks have occurred for decades. The very first outbreak of Ebola was identified November of 1976 in Azura, South Sudan. From years 1995 to 2012, about 1,000 people died from this disease. The virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmission. Ebola is introduced to the human population through close contact with the blood, secretions, organs, or other bodily fluids of infected animals, such as chimpanzees, gorillas, fruit bats, monkeys, forest antelope, and porcupines, found ill or dead in the rainforests of Africa. Ebola spreads from human to human through direct contact with the blood, secretions, organs, or other bodily fluids of the infected people, and with surfaces and materials contaminated with these fluids. According to the World Health Organization, signs and symptoms often begin abruptly within 5 to 10 days of infection with Ebola or Marburg virus. Early signs and symptoms include fever, severe headache, joint and muscle aches, chills, and weaknesses. Over time, symptoms get increasingly severe and may include nausea and vomiting, diarrhea, red eyes, raised rash, chest pain and cough, stomach pain, severe weight loss, bruising, and both internal and external bleeding. Symptoms may appear anywhere from 2 to 21 days after exposure to Ebola, but the average is 8 to 10 days. Symptoms are similar to symptoms of malaria, typhoid fever, and meningitis. Investigations such as ELISA, antigen capture detection test, serum neutralization test, RT-PCR assay, microscopy, and virus isolation by cell culture are done before diagnosing a patient with Ebola virus. Prevention done focuses on avoiding contact with the virus. Community engagement is key to successfully controlling outbreaks, raising awareness of risk factors of Ebola infection and protective measures that individuals can take is an effective way to reduce human transmission. Precautions should be followed, such as avoiding areas of known outbreaks. Highly affected areas such as Guinea, Sierra Leone, and Liberia should be avoided. Nearby African countries should also be verified and prevented for the time being. Remember to wash your hands frequently, just like other infectious diseases. One of the most important preventive measures is frequent hand washing. Use soap and water or use alcohol-based hand rubs containing at least 60% of alcohol if soap and water aren't available. Developing countries, avoid bushmeat. Stop buying and eating wild animals, including non-human primates, sold in local markets. These animals are high carriers of the virus. Most importantly, avoid contact with infected people. For caregivers, avoid contact with body fluids and tissues, including blood, semen, vaginal secretions, and saliva of the infected. People with Ebola are most contagious in the latter stages of the disease. Follow infection control procedures. For healthcare workers, wear protective clothing such as gloves, masks, gowns, and eye shields. Keep infected people isolated from others and dispose of needles and sterilize other instruments. Lastly, don't handle remains. The bodies of people who have died of Ebola disease are still contagious. The WHO aims to prevent Ebola outbreaks by maintaining surveillance for Ebola virus disease and supporting at-risk countries to develop preparedness plans. The drug has been approved to treat either virus. People diagnosed with Ebola virus receive supportive care and treatment for complications. Supportive care rehydration with oral or intravenous fluids and treatment of specific symptoms improve survival. There is as yet no proven treatment available for EVD. However, a range of potential treatment including blood products, immune therapies, and drug therapies are currently being evaluated. No licensed vaccines are available yet, but 2 potential vaccines are undergoing human safety testing. Community awareness about Ebola virus is very essential to us humans. The best way to contain the virus is to educate people with the symptoms, exposure risk, and infection control measures. Also, raising awareness to remote areas is encouraged since social media is difficult to access for them. Giving out flyers, creating posters, and billboards are great Ebola awareness strategy.